In today's Mental Health Check, we are talking about how to support young people who are experiencing mental health challenges. As of 2023, nearly 4 million children and adolescents in the U.S. experienced at least one major depressive episode, but more than 60% of those affected receive no care.
That's partly because there just are not enough therapists, psychologists, and psychiatrists to treat all the kids who need help. Joining us now is Dr. Alec Miller. He's the co-founder and co-director of Cognitive and Behavioral Consultants. He's also the president of the Access Psychology Foundation, and I should say that I also serve on that board with you. Alec, nice to see you.
Nice to see you, Kate.
Let's just first set up the problem. Talk about, you see teens every single day. What are you seeing? What's happening in this generation?
Well, sadly, the mental health crisis persists, and there are about 40% of kids who report feeling sad and lonely. Another 40% say they're anxious or depressed, and 1 in 4 high school students have seriously considered suicide in the past year, and it's a major problem.
Why do you think so many young people are experiencing these negative feelings?
As you know, there's a major range of possibilities and explanations, but a lot of it has to do with the fact that they see so much trauma in their daily life. School shootings from Robb Elementary to Florida State. They get exposed to economic instability, racism, anti-Semitism, natural disasters that you guys cover on the news. It's very anxiety-provoking.
And it's at their fingertips, right? Because we've all got phones, even the kids.
Yeah, so they live it, and they get it vicariously, and they're kind of getting it streaming, which is a huge problem, as you know.
I want to get to solutions. You helped create, we mentioned it, the Access Psychology Foundation, and talk about what are you trying to do? I say we because I'm on the board too, but what is the effort to try to give access to kids that don't have it?
That's exactly it. 4 years ago, we decided we wanted to create an organization that can increase access for underserved populations. So we have 2 solutions. One, we go into schools and we train school staff in therapies that work, teaching life skills to students about how to focus, how to manage emotions, how to tolerate distress. So a whole range of skills for kids to learn how to cope. And when you do that in schools, the teachers also, their burnout goes down, the climate changes, so it has a ripple effect in a significant way. The second piece of APF is workforce development. There's a disproportionate of therapists who are white versus therapists of color. And we want to train more therapists of color to be able to do these effective treatments, go back to their communities, and disseminate it in clinical and school settings.
Yeah, that's so good. Culturally competent care, right?
Yeah, exactly.
I mean, to the note of specific communities, there's been a lot of coverage about the mental health of boys and men. The New York Times recently took a look at this, and they characterized it as this population falling behind, both in academic achievement, but also mental health. What are the specific issues facing boys and men right now?
Well, as you guys probably know, there are issues around academic performance where boys typically are later bloomers academically, so that's one thing, and they start to feel inadequate academically. Excuse me. But secondly, I think there's a stigma still for boys to express emotions. It's not okay. And so they end up suppressing, whereas girls are going to be talking to their friends, getting support. Boys don't know how to get that support, and if they do, and talk about emotions, it's not always appreciated and accepted in our society still, sadly.
Alec, you're an expert, Dr. Miller, I should say. You're an expert in a particular kind of therapy. It's called DBT for short, but it centers on skill building. Can you give us a couple of examples of what kinds of skills can really help?
Well, in this fast-paced age with technology, it's so hard to stay focused with all your attention fragmentation, right? So to be able to teach students and kids how to learn how to stay more focused through mindfulness skills. And when your mind wanders, like the camera lens that I'm looking at, you have to drag it back and stay focused on this moment. You have to be noticing your mind wandering to improve attention. Then there's distress tolerance skills. If you're having impulsive urges, I want to hurt myself. How can I distract or soothe myself to get through the moment without making the situation worse, as some example.
Yeah, and leading into this, we talked about the role schools can play in sort of meeting the need, bridging the gap. Can you end on that for us?
Yeah, I think the schools are the mental health front line, de facto. We have trouble getting access to outpatient care. So to be able to go into schools and train school teachers, school staff on these evidence-based approaches is a game changer.
It's a way to reach a lot more kids.
Exactly right. And like I said, it's the kids, it's the families, and the schools staff themselves.
Dr. Alec Miller, thank you so much.
Pleasure.
Appreciate it.
Thank you for having me.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.